Pregnancy of Bilmed Group of Institutions. Today we will discuss ultrasound in early pregnancy and level 1 scan. What we have to see in level 1, what is this early pregnancy ultrasound all about? We will discuss about that. So first of all, what can be detected in a pregnant ultrasound? A perinatal ultrasound does two things. First of all, it confirms that the patient is pregnant, and number second, it confirms that the fetus is viable. Now in detail, what are the reasons why a doctor performs a perinatal ultrasound? This is the list of the reasons. That first of all, it confirms that the patient is actually pregnant. So first thing is what? It is for the confirmation that anybody is pregnant. Number second, it is to check for any ectopic pregnancy. There can be an ectopic pregnancy. Ectopic means not in the uterus but outside the uterus. So just to rule out any ectopic pregnancies. There can be a molar pregnancy also, to rule out whether we are dealing with a normal pregnancy or a molar pregnancy. Maybe there is a miscarriage. Many times patients don't have bleeding PV, but it is actually a miscarriage, maybe due to some concealed hematomas. So maybe you are dealing with a miscarriage. Just to rule out miscarriage, molar pregnancy and ectopic pregnancy and other pregnancy complications. Maybe something abnormal from the myometrium, something abnormal from the cervix. So these will be the other pregnancy complications. Point number third, to determine whether the fetus, the gestational age, and what is the due date. So this is for the confirmation of how much the pregnancy is right now, what is the gestational age, and what is the due date, that is the EDD. Because EDD here, the calculated EDD, calculated as per CRN, remains superior throughout the pregnancy. So this is for the EDD. Next number is that check if the fetus is growing normally, the movements are there, and the heart rate is normal. Not only the heart rate we have to see, but we have to see how much is the heart rate. We have to at times correlate this heart rate with the CRN to label it as a fetal bradycardia, because fetal bradycardia itself is an abnormal condition, and fetal bradycardia can lead to the miscarriage. So this is for the growth of the fetus, the movements, and the heart rate over there. Then we have to look for the multiple pregnancies. Maybe we are dealing with the twins, triplets, or sometimes quadruplets. Now, to make a diagnosis of twin and to define the chorionicity and amnioticity in early pregnancy is very easy as compared to second and third trimester. So this is early pregnancy is done to determine the chorionicity, amnioticity in case of the triplets, twins, or quadruplets. Now it is to examine your pelvic organs like your uterus, ovaries, and cervix. Now see the importance over here. If I am having an incompetent cervix over here, that can lead to the miscarriage. If I am having something abnormal in ovary, maybe some ovarian cyst over there, that can tell upon the fetal growth. And if something abnormal from the uterus, if there is a fibroid, that can lead to the detachment of the placenta, if the placenta is detached over there. So this is for to examine your pelvic organs of this uterus, ovaries, and the cervix. Then it's for the examination of the amniotic fluid. How much amniotic fluid is over there, because maybe that you are dealing with an oligoamniotic sac, and that oligoamniotic sac is having very high chances land in the miscarriage. So we have to see for the amniotic fluids how much we are having over there, and this is to check the location of the placenta. Sometimes if the placenta is low lying or if it is covering the internal os, we can make out even in early pregnancy we can make it out. And it is to check whether the fetal position, what is the fetal position in uterus. It is for that also, and it is for the detection of the problems with your babies, these organs, muscles or bones in level 1 and onwards. We are seeing for these detailed structures. So these are the reasons why we go for the early pregnancy and level 1 scan. Thank you very much.